Thalassemias are inherited blood disorders caused by reduced production of alpha or beta-globin chains of hemoglobin. Hemoglobin is the oxygen-carrying protein in red blood cells. It is made of two types of chains, alpha and beta.
Normal hemoglobin structure. Let's understand the structure of normal hemoglobin. Normal hemoglobin is made up of 4 globin chains, 2 alpha globin chains and 2 beta globin chains. In healthy individuals, there are 4 functional alpha globin genes. 2 alpha genes come from the mother and 2 come from the father. This normal gene arrangement is written as alpha-alpha/alpha-alpha, or R/R. There are also 2 beta globin genes, with one inherited from each parent, giving the normal pattern written as beta/beta. When all these genes function properly, the body produces normal adult hemoglobin, known as hemoglobin A, which is essential for carrying oxygen throughout the body.
Alpha thalassemia classification. Beta thalassemia. One or both of the 2 genes needed for making the beta-globin chain of hemoglobin are variant. Types of beta thalassemia mutation. First one is beta 0, complete absence of beta-globin chain production. No functional beta chains produced. Usually causes severe anemia. Second one is beta plus, reduced or partially defective beta-globin production. Some beta chains are produced. Usually causes milder anemia. Encoding genes on chromosome 11, short arm. Clinical types of beta thalassemia. This table shows the relationship between the clinical type, genotype, and the level of beta-globin production in beta thalassemia. First, normal, beta. In normal individuals, both beta-globin genes are normal, one inherited from each parent. Therefore, beta-globin production is normal, and there is no anemia. Second, thalassemia minor, trait, genotype, beta 0 or beta plus. In thalassemia minor, one gene is normal and the other gene is defective. If the mutation is beta 0, that gene produces no beta chain. If it is beta plus, it produces a reduced amount. Third type is thalassemia intermedia. Genotype, beta 0, beta plus or beta plus. In thalassemia intermedia, both genes are abnormal, but there is still some beta-globin production. This results in moderately reduced beta-globin levels. Patients develop moderate anemia and may need occasional blood transfusion. Fourth one is thalassemia major. Genotype, beta 0, beta plus, or severe beta plus. In thalassemia major, both genes are severely defective. If the genotype is beta 0, there is complete absence of beta-globin production. In other severe combinations, production is extremely low. Clinical features. Thalassemia minor, also known as the thalassemia trait, is a mild inherited blood disorder. In this condition, the patient has mild microcytic anemia, which means the red blood cells are smaller than normal and contain less hemoglobin. Both the RBC count and hemoglobin level may be slightly reduced, but the anemia is usually mild. Most patients are asymptomatic, meaning they do not show obvious symptoms. However, some individuals may experience mild symptoms such as fatigue, weakness, pallor. Thalassemia intermedia is a moderate form of beta thalassemia. Patients develop moderate and persistent anemia, but it is not as severe as thalassemia major. They may not require regular transfusions, but anemia is chronic. Due to ongoing hemolysis and increased red cell destruction, patients commonly develop splenomegaly, which is enlargement of the spleen. Because of continuous breakdown of red blood cells, there is an increase in unconjugated bilirubin, leading to jaundice. Thalassemia major is the most severe form of beta thalassemia. It presents with severe anemia from early infancy, usually within the first 6 months of life, when fetal hemoglobin starts to decline. Due to severe anemia, affected children show failure to thrive and growth retardation. Because of increased red blood cell destruction and excessive bone marrow activity, patients develop hepatosplenomegaly, leading to abdominal distension. Chronic stimulation of the bone marrow causes marked skeletal abnormalities. One classic radiological feature is the hair on end appearance of the skull, which occurs due to expansion of marrow spaces. Complete blood count is the first investigation. Hemoglobin is usually mildly reduced in thalassemia minor, around 9 to 11 grams per deciliter, moderately reduced in intermedia, 6 to 9 grams per deciliter, and very low in thalassemia major, less than 6 grams per deciliter. The red blood cell count is often normal or slightly elevated, while the mean corpuscular volume, MCV, and mean corpuscular hemoglobin, MCH, are consistently low, reflecting microcytic, hyperchromic anemia. Red cell distribution width, RDW, is usually normal in minor but may be slightly increased in intermedia and major. Peripheral blood smear shows microcytosis, hyperchromia, target cells, and mild anisopoikilocytosis. Since iron deficiency also causes microcytic anemia, it must be excluded before confirming thalassemia, and further tests like hemoglobin electrophoresis or genetic analysis are required for diagnosis.